Hi there and welcome along. Today I'm going to talk to you about what has to be one of the most painful and one of the most debilitating injuries that there are, plantar fasciitis. To you, it's probably a horrific pain underneath the heel of your foot and something that is probably makes you dread even just getting out of bed on the morning. Plantar fasciitis is a really common injury that we see in this physiotherapy clinic, and today I'm going to talk to you about what it is, why it's a problem, not just in terms of the pain that you're feeling, but why it restricts you from doing the things that you want to do. And we'll also look at how physio can help and what you need to do to get the relief that you're looking for. Before I do that, I'll just give you a brief introduction to who I am. That's me. More recently, my physiotherapy career began in Darlington and Middlesbrough football clubs as head physio, and also that's me working in Florida, in America actually, with Paul Scholes of Manchester United at the Footballers Soccer Academy over there. Plantar fasciitis is not just a sports injury, although it is common in runners, bike riders, and people who like to sort of be fell walking and things like that, but it's actually more of a common injury in let's say a person who's 40, 50-year-old, and to be honest, more specifically for females because of shoes and things like that, and sandals and high heels, but I'll talk to you about that as we go along. So first, the real problem with plantar fasciitis is that it can actually be caused by a tight calf muscle. So it's actually very easy to keep looking at the pain underneath the heel, and that's sort of obviously the horrible sort of horrific pain that you feel when you get out of bed on the morning. And from a physio point of view, we look at that, but we also need to look above that injury site as well. And what we often find with plantar fasciitis is that a person will have a really tight calf muscle. There's a huge link to plantar fasciitis and calf muscle injuries, and also the footwear that you use. And you're going to hear me talk about the footwear problem quite a bit with plantar fasciitis, because it is actually one of the major causes of this injury. So we'll talk about that as we go along. But first, let's confirm that you actually have this plantar fasciitis injury. You're going to have a really sharp pain underneath your heel. Nearly always worse on the morning when you first get out of bed, or let's say you've been sat at your desk or you've been sat on the couch for a while and your ankle or your foot is stiffened up. That pain underneath your heel is horrific. It's really, really bad. So any form of period of inactivity leads to this sharp pain underneath your heel. It's nearly always worse on the morning and when you're walking. So let's say you're walking for a period of time, it gets to the point where you feel as though you just don't even want to put your foot down, and the pain comes on gradually and is gradually worsening. So the intensity of the pain is getting worse and it's actually coming on sooner. So this pain on the morning is getting sharper. You know, patients often describe this pain to me as if they're standing out of bed on the morning and there's a pin there. Somebody puts a pin on the side of their bed, and every time that they put their foot down, it's as if their foot lands down on a pin. It's that sharp and it's that painful and it's that uncomfortable. So if that's the sort of feelings and the pain and the thoughts that you're having, it sounds as though plantar fasciitis is definitely for you. Footwear. Okay, so changed footwear recently. We see this a lot in females aged 40 to 50 who go from high heels to flats. So for example, you've been on holiday recently, you wear high heels traditionally for work, for wandering around, and all of a sudden you've gone into sandals and flip-flops. And it's an injury which as well, people won't even be aware of it, but as the summer months come and people get into their flip-flops, their sandals, their flats, their trainers, they're walking along the seafront of Hartlepool, or they're wandering around Gisborough, Durham, or on a flat in Darlington somewhere in these now flat shoes, it puts a tremendous strain on your calf and your Achilles, which causes pain in your plantar fascia, or makes you a candidate for that sort of pain. So have a think about anything that you might change recently. Even if you've changed the style of footwear, the type of footwear, it can cause you problems. So what actually is it? Well, it's a thick band of fascia underneath your foot. Basically just connects the front of your foot to the back. It's not a muscle. It's very unlikely to snap, but it can be caused, and the pain that you get can be caused by an overuse injury where you get lots of little tears. So because of the extra pressure, because of the extra pounding or the walking that you're doing, if your foot isn't in the right position or it's not being supported by the correct footwear, you can get lots of little tears in this muscle, or this fascia, sorry. So it leads to inflammation, pain, and obviously the thing that you feel every time you go to walk or you step your foot out of bed on the morning. Think of it like this. Imagine an elastic band. If you pulled an elastic band really tight, somewhere in the middle there would be lots of tension. There would be a point in that band where the tension would be at its highest or its most, and that's what happens with this fascia. You pull it really, really tight, it gets stretched because of overuse and because of this poor footwear. So somewhere in this fascia, somewhere in this band, is a tensile point. That point is usually where you'll feel your pain, and it's often literally right underneath where the heel bone is. So why are you getting the pain and the restriction? Well, these fibers, this fascia is constantly being stretched, which causes this micro tear, leads to the inflammation, and then what happens is this thing heals wrong. So your body will put down what we call scar tissue, which is kind of like a glue or a cement. Think of breaking something in your house or at home. You'll probably try and fix it with a glue to make it a bit stronger again, and that's what happens with this fascia. And have a quick look at the image on the left. Those are the two hotspot areas I've highlighted in green where a person will feel. That would be a person's left foot, so you're likely to get the pain right at the back underneath the heel or just underneath the arch, and that's usually where a person comes in for physio and will tell us that they're feeling that pain, and it's because this inflammation and these micro tears are happening so often. They call it little and often. It's happening repeatedly. You won't know it's there to start with, but it is happening. And as your body heals with this scar tissue or this glue, it's too thick, it's too strong, it's too tight, and you've got this elastic band theory going on pretty much all day long. Importantly, what do you need to do to get help? Well, physio can definitely help. It's a really common injury that we see. You need hands-on treatment. Okay, stretches and advice are great, but ultimately hands-on treatment is what you need. So we'll do lots of massage. We need to get our fingers in. It would be a little bit uncomfortable to start with, but it's something that we're just trying to make this fascia, this band, a lot more flexible and a lot more elastic than it currently is. You need a great explanation. You need something that's specific to you. So if your pain is being caused by high heels and you've gone into flats, or if you're a runner and yours is caused by just simply overuse, we need to look at things to help you. So it may be that it's a back problem. You've got a lot of weakness at your back or the calf muscles, or even in the quad muscles, the hamstring muscles. If they're not working properly, it kind of means that there's more pressure and more impact going through that foot, which makes you more likely of a candidate for this injury. So we'll give you an explanation specific to you, and we'll also give you these great exercises to do at home as well. So you combine the hands-on treatment with the exercises, and it's the best way to get relief from plantar fasciitis. Ice is great as well, by the way. If you're looking for something to do for yourself right now, I would be using ice every hour for about 10 minutes to get that inflammation under control. And we'll also tell you, if you ask me what the number one reason for visiting a physio is, not just for the hands-on treatment, it's to be told when it's safe to do what you want to do. So you might want to play your badminton, or you might want to go for a walk in Gisborough or along the seafront in Hartlepool, which, by the way, the sand makes you more of a candidate for this because of the pressure that it places on Achilles and calf muscles. You need to know when it's safe for you to return to do the things that you love to do. Okay, it's one thing returning, but if that pain comes back a week later, then you haven't got the great advice that you needed, basically. So visit us for help as soon as you can. We can definitely help with plantar fasciitis. It helps if you get to us quickly. Sometimes people come to us after a year, 18 months with these injuries, and it's often there's very little we can do other than sort of refer on for injections and consultant advice, even surgery from that point onwards. But if it's in the first few weeks and months of the injury, there's a very good chance that we can help you. It'll probably take us 3 to 4 weeks, at least 3 or 4 sessions with plantar fasciitis. You need lots of deep massage, some stretching, and some great exercises designed specifically for you, which won't just be around the foot. It'll be about the knee and also the back. So if you want to get back to running, or you want to get back to your sport, or even just walking on a night with your friends, then physiotherapy can definitely help you. Where are we? Our physio clinics are in Darlington, we're in Durham, we're in Gisborough, and we're also in Hartlepool. And we always offer this. If it turns out that it isn't plantar fasciitis that you're suffering with, we'll give you a session free if we can't help. Hopefully we'll be able to tell you what it is and give you the treatment for that. But if it turns out that it's neither, you'll not have to pay for your session of physio with us. How do you get to us? The number you need is 0800 043 8671, and the image that you're looking at there is it's kind of what our clinics look like. That's the Hartlepool physiotherapy practice. That's inside in the reception, and the person that you can see who looks as though she's about to start doing some work is Vicky, and she could be one of the girls who would happily take your call if you call us. And just before I finish, I'll show you 1 or 2 great images inside our clinics. That's the Gisborough clinic. We're on Challoner Street over there in Gisborough, and all of our staff, they're really active, they're really fun, they're really friendly, very outgoing sort of people. And there's 4 of them, there's others in the other room there as well, doing an in-house yoga class that we do. We do in-house Pilates and yoga for our staff, and those are the things that we encourage our patients to be doing as well. So gives you a little bit of an insight into what we're like as people. And there we are in Hartlepool as well. Vicky looking after 1 or 2 of the guests who come in and see us for treatment. So a little bit of a look inside what our clinics actually look like. I'll just recap. If you are suffering with plantar fasciitis, we can help. You need great hands-on physio, you need an explanation specific to you, exercises to do at home, and you also need to know when it's safe to return. So physio can definitely help. Please give us a call. We'd look forward to hearing from you. Telephone number you need is 0800 043 8671. That's it for me. Thanks for watching. Take care, and I'll speak to you soon.